Welcome everybody to the Accreditation, Certification, and Patient-Centered Medical Home Huddle series. My name is Natasha Green, and with me today I will have Becky Blystone actually be the discussion or chat assistant here. So thank you, Becky, for stepping in that role. Today's session will be covering the Accreditation Guide and preparing for continuous readiness. This huddle series is part of the Partnership to Advance Tribal Health Project, and it's a collaboration of all of our quality improvement organizations listed there. Next slide, please. For today's agenda, we'll first start off by doing a welcome and going over our objectives. We have huddle series objectives as well as a session objective. We'll then review our new accreditation guide developed by PATH, and then we'll close out our session by doing an open discussion and open office hours. Next slide, please. So welcome to this Accreditation Huddle series. There's 8 sessions in total, with today's session being the first one, the Accreditation Guide and Preparing for Continuous Readiness, and we'll close out our last session on July 28th. Each of these sessions are held on a Wednesday at 2 p.m. Central Time, 1 p.m. Mountain Time. So why do these huddle sessions matter to you? Well, first of all facilities must be accredited, and the materials developed and presented during these huddle sessions will help you towards that accreditation process. Secondly, all facilities must obtain their patient-centered medical home designation by December 21 as set forth by IHS headquarters. And so again, these huddle series are meant to help prepare you and your teams towards working towards that designation. And finally, these huddle series align with the IHS goal number 2, which is to promote excellence and quality through innovation of the Indian health system into an optimally performing organization. As we work through today's session, if you have any questions that you'd like to go through, please go ahead and put any questions into the chat box. Next slide, please. So for our series objectives, we hope that individuals will learn and apply new techniques and tools to use with accreditation. We also hope that it'll improve overall accreditation knowledge and finally improve overall PCMH knowledge. Next slide, please. So to get started, we have 2 polling questions. The first question is for you to please rate your current accreditation knowledge. This will help me and my team help guide you as we do these huddle series with information so that way we can meet the needs of each of you. The first one is very little knowledge, with being 1 with 5 equaling proficient. For the second question, we want you to rate your current PCMH knowledge. Again, 1 being very little knowledge and 5 being proficient. As we're waiting for individuals to complete that poll, if you could type into chat your name and the facility that you're from, and as a fun thing that I always like to do during PCMH huddles, the temperature that you have in your current location, just to share where we are at throughout the nation, that would be great. I'm from Bismarck, North Dakota, and right now it's 80 degrees, which has been a nice break from what we've been having in the Dakotas. We've been pretty steamy up here, crossing over 100 and breaking some records, which has been crazy for us. So go ahead and type your name and the organization that you're from into chat, and then of course that temperature for your location. I see Veronica, it's 80s there in Red Lake, and then in Cass Lake, 85 degrees. Excellent, Georgia. Let's keep those coming in. Okay, let's go ahead and share the polls. Okay, so we have a variety, which is great to see. We have for the first one for accreditation knowledge, some rating at 3s while others are rating at 5. Which is great. That tells me that we have some really good knowledge set when it comes to accreditation, but there's still opportunity for growth. For PCMH, I see some 2s, some 3s, some 4s, and some 5s. So again, with PCMH, that tells me that we have a lot of opportunity for growth. During these huddle series, it's a great opportunity for networking. And so we love to hear from each other. We love to share what we're learning and what we know. So again, keep an open mind with that as we work through this huddle series, and keep that open during our open discussion time frame. All right, I see some 90 degrees as well, and that's in New Mexico. Suzanne, you're a little toasty there. And 88 degrees in Lawton, and Claremore is 86 degrees. So we're all pretty toasty this summer. Okay, we'll go ahead and advance on to the next slide. Okay, so as I mentioned before, today's session will specifically be going over the accreditation guide and preparing for continuous readiness. But again, please type any questions or requests into chat. So specifically for today's objectives, we hope that the teams and you all here understand the basic concepts of survey readiness and learn how to access and use the PATH Accreditation Prep Guideline. Next slide, please. So the PATH team has developed a really great new tool. This tool can be found on the PATH website. I pasted the link directly to this resource into the chat box so you all can download that tool and follow along. It's a great resource for new and even seasoned leadership team members, and it gives a checklist to follow at each step of the accreditation process, which is why it's so great. It's kind of that list of things to do to help prepare for accreditation. And for today's session, we'll go through what each of those concepts show. Next slide, please. It starts off by discussing a gap analysis and self-assessment, tracers and mock surveys. It'll go over the pre-survey planning and prep, what to do during the survey, your post-survey response, and then it has a lot of great appendix and ideas or tools that you can use during your accreditation preparation. Next slide, please. This first tool is called the Activity Guideline, and this is just the overarching checklist. And this is a great resource to use, especially when presenting a snapshot to your leadership team. It describes briefly the activities that should occur 30 days or 30 months before a survey, all the way through your post-survey response. It has the gap analysis and self-assessment section, tracers and mock surveys, the pre-survey planning and prep, what to do during the survey, and the post-survey response. And the guide that follows is broken down by each of these sections in more detail to give you additional information as you're working through your accreditation preparation process. Next slide, please. The first step when preparing for accreditation is your gap analysis and self-assessment. It's important to figure out where you are at. The first step to do this is to make sure that you have an accreditation committee or incorporate into an existing committee. It's important that you schedule recurring meetings and make sure that you're discussing and have your gap analysis processes, your agenda, things that you need to be discussing during these meetings ready to go. It's also important to assign a departmental or topical chapter champion. These are individuals who can be considered a subject matter expert for a specific topic, like infection control. And these chapter champions can help the entire organization through understanding certain sections of accreditation. Ensuring leadership support is important as well as you're setting your committee up. And this is because you need resources. When you're preparing for accreditation, it's hard to try to do it all at once right before your recertification or your certification is due. And it's important that you practice and have this available to you 24/7 all throughout the year. Once you have your committee formed, you have the right stakeholders available. The next step is to just simply review each of the regulations and accreditation requirements. Once you're doing that, you can take any of the ones that you're not meeting and apply those to a gap analysis tool or action plan. You'll want to self-assess and document how the facility demonstrates compliance with each of their requirements as a committee. And this is important because you want to make sure that your staff can speak to current policies, procedures, and that you're not just checking a box that something's done. You're ensuring that you have that evidence of compliance, which supports you meeting a certain standard. Next slide, please. Thank you. As I mentioned before, you'll want to have that action plan, and we have a tool that can be used as an example if you don't have a resource like that. But again, those action plans are meant to address areas of non-compliance and are meant to be timely and to set someone who's responsible for those. After you've done your gap analysis, you reviewed the standards, you know which ones are met, which ones you're working on or in process for, it's important that you have tracers and mock surveys. This helps ensure that your staff feel comfortable for when a surveyor is on site. Champions and staff can perform these tracers on their own department or via direct observation. And in this guide, we do have a great tool that you can use and reference when completing a tracer or mock survey. You can also have external partners perform tracers or mock surveys. I know oftentimes we see area offices conduct these mock surveys, or you can hire consultants like the Joint Commission Resources to come in and do these. But again, having your supervisors and your own staff conduct regular tracers or mock surveys can really help lead you to success when you come your survey timeframe. The last step is the pre-survey, or not last step, but the last one of this slide is the pre-survey planning and prep. So you'll want to make sure that you submit your application and required information to the accrediting body. And this takes time. You'll have to work with your area office and even your tribe and local community regarding any certification changes or accreditation changes. And this information can take time. So make sure that, again, you work with your area office to complete this application. Next slide, please. When you work on your application, during this time, you can also submit preferred dates and blackout dates for surveys. And you can work on training your staff as scribes, escorts, and command center support. In this tool, we have the definitions of what each of these roles can look like, and they each play an essential role during a survey. Lastly, you'll want to prepare and reserve a designated secure space for your surveyors to meet. This is important because you don't want your surveyors just going around unattended. And that's why having those roles such as the scribes and escorts can be very important. Next slide. Also during your preparation, you'll want to gather all required documentation that's required or recommended by an accrediting agency. A great resource to use and to help guide you is the Joint Commission Resources Big Book of Checklists. Many times what I see is that facilities create a binder so that way everything is ready to go if surveyors show on site. Or you can have all of your files located on a shared drive that is secure but has access by those who would require access. If you do use a shared drive, just keep in mind that you'll have to probably print off some of these items, so consider that time frame for that. And that is why most just create a binder of some sort to have ready. That leads us to the survey time frame. So during the day of the survey, as this tool mentions, you'll want to make sure that your teams, your registration teams specifically, are trained to welcome the surveyors and where to take surveyors during a survey. You'll want to go ahead and alert all staff that surveyors are on site with either an overhead announcement or email. And then you can activate your command center. And this will get all of the executive leadership or the accreditation team ready to go in their command center spot. And then you'll also orientate the surveyors to the location with all of the information that they need for their survey. Next slide, please. After you've hopefully had a successful survey, the last step is the post-survey response. And as I showed on the original slide with the checklist, this is all a moving circle. It's continuous readiness. So although we have post-survey response, really survey readiness is a continuous circle and is always going. So once you've had your survey, Of course, you'll need to submit a plan of correction. The biggest tool guidance that I can provide for you here is to make sure that you have an internal due date for this, but that you delegate sections out and that one person isn't doing the whole plan of corrections. This will help alleviate the burden from one or a small set of team members completing this plan of correction. It's important that it gets completed and done on a timely basis and that the leadership team has time to review it. But please involve the right stakeholders to complete those plans of correction. The second checkbox is to implement the corrective action plan with a clear timeline and deadlines based on findings. Some of the things that we often see is that you have this plan of correction, you implement the plan of correction, but we don't have sustainability with those plans of correction. So for a small limited time, we see that staff maybe do the plan of correction, but then it falls off or they drift off from that new process. So make sure as you're correcting your action items in your findings that you monitor those for a while to ensure sustainability. And then lastly, as I mentioned before, begin that gap analysis and self-assessment process again. You always want to make sure that you're up to date with new and revised standards, and then you can use your tools to help make sure your team feels comfortable and successful during the survey process. Okay, next slide, please. Here's an example of the corrective action plan gap analysis tool that can be found in the guide. This is just a simple tool. Again, as you're reviewing the standards, you find one that you're not meeting, you can write the standard down, what your corrective actions will be, who's responsible for it, and the target completion date in your progress towards it. Again, just a simple tool to help you and your team make sure that you're successful when you're working through the accreditation process. Next slide, please. Here's the accreditation roles. So again, we talk about what is a champion? What does it mean to be in that role? Who's the scribe and who's the escort? What do each of those roles mean? What is it important for them to know? And again, it just briefly gives those roles so you can provide a brief training to your teams to ensure that you have the right people there during the survey. Next slide, please. Here's a mock survey form example that we have in the guidebook. And this tool I really love to use when doing tracers within an organization. To use this tool during in the second section where it says questions and or topics, I like to put the standards or the COPs that I'm wanting to review in a certain area, some questions that I would like to have answered during that mock survey tracer that I'm conducting, and then I put my evidence of compliance below in each section in each box. And this is a great tool to review. It cannot be done on a large scale for me anyways. I just like to use it on a smaller scale. So if there's medication management that I'm trying to review, I'll write the medication management standard that I'm reviewing, what specific questions I'll review to ensure I can figure out compliance. And then I can follow along as I conduct my tracer or my interview of the team or process. Next slide, please. Okay, so we've made it through our tool. We've kind of discussed some key highlights when it comes to the accreditation process. Are there any questions in the chat?
Hey, so I am about to drop the link into chat again for today's resource, just in case you all missed it with all the temperatures coming through. But I wanted to note that Veronica from Red Lake actually asked a question early on. She wanted to make sure that we tackled it, so she went ahead and added it in the beginning of the presentation. It was a request for anyone, if anyone has PCMH policies that they can share. Veronica, feel free to come off mute if you had any more information around that, but Natasha, do you have any recommendations or thoughts for that request?
I'll give it just a second in case Veronica wants to come off of mute. Okay, perfect. So yes, there are policy examples that we've used for PCMH. So Veronica, what I will do is write your email down or take note of your email, and I will connect you with some of the facilities who have used some of the PCMH policies or at least give an example of their PCMH policies that they've used. Anyone else if you would like an example of that policy, please type yes into chat so that way we can go ahead and make sure to get that sent out to you. Excellent. Yes, we do have some examples. I will say it's mostly referencing, it's not specific. When we talk about PCMH and the different accrediting agencies, they cover similar topics, but it does reference Joint Commission, just so you all know that. You may have to make a few modifications, but we do have PCMH policy examples. Thanks, Becky. And that's
sure, and I have one more item for you. Do you have
sure.
any PCMH competency examples?
That's a difficult one for competencies. We do not have specific competencies, just because for PCMH it's more so meeting the standard or not meeting the standard. But what we do have are patient experience questionnaires. IHS has their own versions of that. So if you would like that information, so that way you can start implementing patient experience feedback, it'll give you a little bit more information on what they're looking for. So we talk about shared decision making. What tools are you using for that? So you may build a competency based on whatever shared decision making tool that you're using. And so it's a little difficult to have a generalized competency on PCMH. But if there's a specific training that you'd like to have developed, you can go ahead and type that into chat as well. We can take that back to our team to work on. I hope that answered your question, Becky.
Sure, thanks. And you all are welcome to message me directly in chat if that's helpful for you, or you're welcome to pose it to the entire team.
Are there any other questions specifically related to accreditation or PCMH? And we will have an open office hours that will start at 30 minutes. And again, that's just a time for you to ask whatever questions that you would like to ask regarding any accreditation or PCMH question that you may have. Open forum.
So I did receive one more question. I'm going to read it as is, just to make sure I don't misinterpret. But the question is, does PATH have the big book of checklists?
Yes, so if you work with your PATH QIA, we do have a resource, the Big Book of the Joint Commission Big Book of Checklists, so we can help guide you to that resource. And if you don't know who your PATH QIA is, please just reach out to us into chat and we can help connect you to that person. Great question. Okay, let's go ahead. We'll still be doing the open discussion, but I know we have a few resources that we wanted to highlight for this session. Let's go ahead and advance the slide to the next one. We do have another poll, and this one is just asking if you felt the session today helped you understand the tools and techniques to use towards achieving accreditation. So we want to make sure that the tools that we're sharing with you are helpful and meaningful for you as you work through your accreditation process. And we really appreciate everyone's feedback because that only helps us help you. Now, if you would like, in the chat, if you could tell us some content that you would like to see in some of the future accreditation or PCMH huddles, please feel free to type that into chat now as well. Okay, I think we're good with that polling question. Looks like overall everybody felt like today's session over this tool was very helpful. That's great to hear. Let's go ahead and advance to the next slide, please. Just as a reminder, next session will be covering our patient-centered medical home Joint Commission gap analysis tool. So it'll be more focused on PCMH. You may have heard from your QIA that we're helping each facility complete their gap analysis tool for PCMH. And so we'll go over how to complete that tool, and then we'll talk about some of the standards specifically. So if you're working through this tool already, great, come back to us. Tell us some of the barriers that you're experiencing or things that you may have questions on regarding that, so that way we can work through it and discuss it as a team. And again, same Wednesday at 2 p.m. Central Daylight Time or 1 p.m. Mountain Daylight Time. And thank you, Deborah, for your chat. Oh, sorry. Go ahead.
Perfect. Go ahead.
I was going to say thank you, Deborah, for your suggestion. You put a tool to help champions and leads make recommended corrective actions. So we'll take that down, Deborah, and make sure that we can bring something back to the huddle series to help with that. And if you think of anything else, everyone on the call, please feel free to add that into here. Okay, next slide, please. So we put together some resources and links that may be helpful to you. This came out in the email that came from the PATH team earlier today. So check that out, because you'll get the slides with these links in it. But we have the Joint Commission Pathway to Accreditation ebook. That is a wonderful resource to help guide you during your accreditation process. We also have the General CMS Survey Readiness Checklist, which is on the Joint Commission Resources webpage. This is similar to the accreditation guidebook that we have, but it just has a yes or a no during it, and it walks you straight through it, which is so helpful. So make sure to check out that resource as well. I'm just pasting some of these links into here as we go on. And then we've been receiving emails or hearing a lot about the CMS Emergency Preparedness Manual. So go ahead and check that link out as well. Next slide, please. And then if some of you are critical access hospitals, we want to make sure to connect you to your Centers for Rural Health or your FLEX program. So if you are a critical access hospital, or if you're transitioning into a critical access hospital, please check out this link at theruralcenter.org to find the FLEX program for your area. You just click in there and select the region that you're in, and it'll connect you to the FLEX program for you. They have a lot of excellent resources for you and can help with the accreditation process if you're transitioning to CAH or if you are a CAH. The next one is the Joint Commission Perspectives, Joint Commission Resources. This one's a great resource to use if you have access to it. Some of these resources, depending on what you have access to with Joint Commission Resources, you may have access to or not. And then recently there was a Joint Commission hot topic that came out, Accreditation Survey Preparedness for Sterile Processing Professionals. We're hearing a lot around infection prevention, infection control, sterile processing when it comes to the accreditation process. So click this PDF for a good resource related to that. Okay, next slide, please.
We might be having a bit of a delay, Natasha.
Oh, yep, I'm sorry, that's on my part. Let's just go to the open discussion slide, back on slide 19. Sorry about that. And we'll open it up for our open office hours section of our huddle series. Again, we'll be here with our subject matter experts. So if you have any questions or want to share any best practices, related to accreditation or PCMH will be here on the line, whether it's quiet or a lot of discussion for the next 15 minutes. So this is your time to feel free to ask any questions or to share knowledge.
And I wanted to note, Natasha, before we kick off with any questions for this team, that I will be dropping a link into chat. It's a questionnaire about today's event. It will help us hone these huddles so that they are helpful and effective for you all. So if you have a moment, please click that link and just answer a couple questions for us.
Thank you. And I'm posting all the resources from the slides in here. I did have a question actually from one of my PATH colleagues, and I hope you're okay with sharing, Nancy. Would you mind coming off mute and asking your question for the group? It's a really great question.
Yeah, you bet. It was timely. I literally got the question 15 minutes before this call, and so I referred the facility, please join the call if you'd like, but I thought I would ask for them, and if there's any of them on the call, which I'm not recognizing any of the names, but that doesn't mean that there's somebody else from the team that I just don't recognize on here. But their question was, in a PCMH clinic, if a provider calls in sick, what do you do? Is there any specific PCMH guidance on this? Would it be just that the providers absorb those patients and you would reschedule the patients that work best for the patient schedule, or what are your thoughts on that?
Great question. That's a really great question. There's quite a few things that you could do. So one of those is, since you set up care teams, that includes multiple providers who are practicing. So when a provider calls in sick, the goal is that you have access to a variety of providers who have some open time slots for urgent or day of cases. So you have that availability. Now, that's not going to take care of every patient, especially that day. And so the goal is that when a provider calls in sick, that you take those first morning patients, and as a care team, try to accomplish those morning patients, because they probably would have already shown up to the clinic that day without receiving the cancellation. So the first goal would be registration staff and the care team staff, MSAs, call the patients to let them know that their provider is out ill, and one asks them if they would like to reschedule, or they offer them other appointment options that are available that day or within a specific time frame for the care team providers. And that gives the patient the choice to either reschedule with their own provider, but then also if a patient does show up, or if a few morning patients do show up, the care team providers work collaboratively together to accomplish fitting those patients into their schedule. There isn't a specific outline, but that's generally how it works or is set up. Great question, though.
Thank you.
You're welcome. Are there any other questions? You can put them into chat, or if you'd like to come off of mute, feel free to come off of mute.
Natasha, this is Nancy again, and I did have another question from another facility that was on earlier. I'm not sure if I still see them on today, but we've been privy to already taking a look at and working through the gap analysis tool on PCMH. And there were a couple of standards in the gap analysis tool that they had some questions on. Should we wait and ask those questions when you're reviewing the tool next week?
Either or is fine. Now is the open office hour, so we can ask away.
Okay. So there is one on the patient centeredness one about the patient's clinical record contains blood pressure. And then the patient's clinical record contains smoking status. That was a question on what standards. They didn't see those standards in there. And then there was one other one on the systems for quality and safety. The organization uses a computerized order entry system for at least 60% of medical orders. And the organization uses the computerized order entry system for at least 30% of the lab orders. So there are actual standard numbers on there, but we couldn't locate those when we were on the call yesterday.
In the manual, is that correct?
Yeah. So
Yes.
very specific question, and if we can't get the answer to that until next week, that's fine.
No, that is a-okay. So let me go ahead. I'm just gonna steal screen sharing here for a minute. I need to find the smoking cessation one. So let me find that quickly. Okay. All right, so the question that Nancy was speaking about, and this is our tool for next week, so we'll go a little bit more in depth then. The first one was blood pressure and smoking status. So Nancy, you were asking about where the standard was for that one. It should be right here.
Okay.
And this refers to these ones.
Okay.
Now, this tool is built, and one thing I will say about Joint Commission resources, and the unfortunate thing about them is on their website, they have their gap analysis tool. And so to refer to your second question, they do not update their website with their PCMH items very often. So what we are finding is that sometimes they may have a standard referenced here, and it may be a different EP in the current manual. Okay.
And that's what we were running into. The facility I was working with actually was able to pull the standard up and didn't see the exact crosswalk. So we will research that a little bit more.
Yes, and once they update their gap analysis, which we don't know when, sometimes I think they update it every 2-3 years, the gap analysis from what I've seen. But once they update it, we'll make sure to update our tool to reflect that. But this is reflecting the standards that are part of that self-assessment gap analysis. I hope that was helpful. That was a good question because
yeah, it was. Thank you. I will make sure I follow up with them.
Are there any other questions?
Nothing has come into chat just yet.
Thanks, Becky. All right, well, since we don't have any other questions coming in as of yet, I just wanted to take this time to say thank you to our PATH team for putting this first session together. Again, if you have any questions, please reach out to myself or your PATH QIA to help guide you when it comes to the accreditation process or PCMH process. And if you have any specific requests, please again reach out to your PATH QIA. Otherwise, we'll see you next week where we'll talk a little bit more about PCMH, the new tool, and some PCMH standards, especially those that have been a little challenging to meet. Thank you to Becky and Jonathan for your work. I appreciate you both, and Francesca as well.
Thanks,
Thank you,
Natasha.
everyone. We will be sure to get out. We will be sure to get out those the requests from those of you who let us know you would like an email about the policies. We will send that out to you.
Thanks, everyone.
Thank you all. Have a good day.